Hello, it's Dr. Christine Arsenault, PharmD Functional Medicine Certified Health Coach, coming to you live from wine country. And it is a cool, rainy day today. I've got my blanket here sitting outside. I just wanted to show you beautiful wine country here before we get started. The new scenery. It's a bit foggy with all the rain today. So you can't see the mountain, but there's Mount St. Helena over there. And just a beautiful green field, rolling hills. It actually reminds me a lot of Germany. For those of you who don't know, I'm a German citizen as well as an American citizen. And I grew up mostly in Germany, but also multiple places in the US. My dad was in the military. So I grew up in Germany and the US, and wine country reminds me a lot of Germany with the rolling hills and the green, and especially today with the rain, because we get quite a bit of rain in Germany. You know, conventional medicine, they tend to use 2 weeks of antibiotics. That's about it. If you come from a comprehensive plan, a holistic plan, if you're looking at these other things, you can have more success. The Borrelia itself doesn't necessarily make you symptomatic. So it's an opportunistic infection. And so usually the host has to be somewhat compromised for the Borrelia to take over and cause symptoms. And usually the more compromised you are, the more opportunistic infections that can take over you. So we talk about, Pasteur's germ theory and how germs make us sick, but there's also the terrain theory where your terrain, your body, your environment is really important. And it's not just about the bugs, it's about how healthy you are. And so you need a complex approach. Gut dysbiosis is a big one. If you have gut issues and you're not fixing that, you're going to not be able to completely heal because your body needs your gut to take care of the die-off. It needs it to detox. Although Lyme itself is from a bacteria, it's wreaking havoc everywhere in your body. It's causing damage throughout. So you really have to look throughout your body and address any other imbalances. We're talking about social history, traumatic events. All of these things can play into your Lyme diagnosis and how, it's an opportunistic infection. Maybe your body had it under control until you had some trauma in your life that compromised your immune system and allowed it to take over. So all of these things in your history are actually important. Also important because your environment can have other things that are causing health issues. So you could have heavy metals or molds. You want to do comprehensive lab testing. So not just the tick-borne infection tests, but which you do want, especially all the co-infections, because if you know exactly what you're treating, then you'll be able to have a more targeted treatment approach. But also we want to look at methylation issues. We want to look at possible autoimmune issues. We want to look at your hormone levels. We want to do stool tests. We want to look at food allergies, heavy metals, mold, thyroid. So you want to work with a practitioner who's going to do a comprehensive analysis and really look at all these things, because Lyme can affect all of those things. And it's not just about treating the Lyme. You also have to treat the underlying imbalances that it caused. The Lyme testing is only about 30% accurate. So if you got a negative and you ruled it out, but you're not using a test that's very accurate, then that negative might not be an accurate assessment. So that's why the more testing you can do, the more comprehensive you can be, is really important. And of course, the physical exam is important as well. And just really, really that social history, that environment, that can really give you some clues to what's going on, why you might not be getting completely better, getting to that level where you want to be. About how heat kills Borrelia. So when we get to 41.6 Celsius or 106.9 Fahrenheit for 2 hours, Borrelia is completely killed. It can't survive. So, and we can eradicate it wherever it's located, even in the brain and nervous system with hyperthermia. Hyperthermia causes you to lose a lot of fluids. So like 6 to 7 liters of fluids through your sweat and urine. And that's a really good way to detox. That it can get heavy metals out that way. So there's a really huge benefit of hyperthermia in just the detox alone. So that's something important to remember. The hyperthermia has also shown changes in stool and urine, so improving the mucosa in the bowel. Skin color changes can be noted after. And then they really take care of that toxic load by apheresis and chelation afterwards, so that they're taking care of all the debris, everything that was died off during the hyperthermia, so that you're not having this immense Herx reaction. So these other adjunct treatments that they use help you recover faster. And so he listed some specific results that they see after the augmented antibiotic therapy. So this is specifically hyperthermia with antibiotics, as well as the chelation and detox and everything that they're doing after. So it's a whole protocol that is set a specific way to have the most benefits from the hyperthermia. And the benefits that he listed that they see when people do this is more energy, ability to think clearer, improved memory, increased range of motion, less or no pain. People were able to stop medication. They were able to balance their weight, reduce or stop addicting patterns, feel better about themselves and easier to manage life challenges, and then just improve their quality of life significantly to undertake big life transformations. So I think of hyperthermia as a transformative journey, but it's not the end of the road. It's not the end of the journey. So if you're expecting it to be a cure-all, to go somewhere for 2 weeks or 3 weeks and to just be done with your Lyme disease and perfectly healthy, then you may be disappointed. That's probably not realistic for most people. So remember, this organism has done damage to your body and caused imbalances, and those need to be corrected. And we need a comprehensive approach where we're looking at how exactly your body was connected, looking at the root causes, seeing what we can fix, what we can balance, so that you're able to fully heal from the bacteria. So yeah, the take-home message would be it all comes down to personalized medicine. So what are your issues that are preventing you from detoxifying, and how can we tweak things so that you're having the most benefit from detox, making sure you have things in balance. And then, of course, we do want to get rid of the bacteria and organisms that aren't supposed to be there, but that's only a part of the picture.